Well, hello. As you know, REACH, the nonprofit arm of Axiom, was created 5 years ago with the mission to serve our citizens in the underserved communities, be it support for cancer or rare disease patients in the form of rent, chemo copay support, housing, nutrition, transportation, hospice care, and when it comes to scholarship for students in the underrepresented communities, scholarship in the form of support for folks who are trying to pursue an education in the medical or nursing field, and all the other ad hoc support we have been able to provide in the middle of the pandemic, we call our Starfish program. Our partners will highlight some of the work we have been doing. Thank you for your support. We could not have done it without you. Looking forward to greater partnerships in 2022.
Axiom REACH has grown a lot in 2021. It's been a long and challenging year for many. Hybrid work and video messages like this one included. Nevertheless, REACH is excited to share what we've accomplished in 2021 and what we're looking forward to in 2022.
So I would like to take this opportunity to thank Axiom REACH for their support of the Rutgers Cancer Institute of New Jersey at University Hospital. The transportation and the financial assistance provided have greatly impacted so many patients.
University Hospital, CINJ, we're located in Newark, New Jersey. The area itself is impoverished. It's an urbanized area that needs a lot of assistance because we do have a lot of barriers. And when Axiom REACH came in, it was absolutely amazing because yes, or the other organizations are here, but they don't do what Axiom REACH does. And what I mean by that is they actually address a larger need. So
one of the most wonderful things about Axiom REACH is the fact that they allow us to help who we feel needs help. Many times depending on what a diagnosis is with someone, there are very, very few resources out there for them. For example, breast cancer patients, there are a number of resources that we can tap into. But Axiom also, they have taken the time, we've really started to develop a great working relationship, and has taken the time to want to know the actual patient population that we are working with.
Happy holidays from Rutgers University. My name is Katie Mayfield, and I'm the Director of Development from the Rutgers School of Health Professions.
My name is Leisha Baden, and I'm the Director of Development for the Rutgers School of Nursing. As we come together to celebrate this season of giving and reflect on the past year and our accomplishments, we are grateful for our partnership with Axiom. Katie, why is Argos so important?
Argos is a really unique program, and I see it as having an importance in 3 different ways. First, it's going to have a tremendous impact on individual lives. By providing full tuition scholarships to 2 physician assistant students and 2 nursing students, plus an educational stipend, we're removing those financial barriers that diverse students sometimes feel when seeing themselves entering the medical field. Additionally, it's going to have an enormous impact on the communities surrounding Axiom REACH and its partners by choosing to establish these scholarships at the State University of New Jersey, Rutgers. And finally, it's going to have a systems level impact. We all know that there are health disparities nationally and globally around cancer care. By developing a diverse pipeline of practitioners who reflect the communities they will go on to serve, Argos is creating enormous and long-term systems change.
That being said, on behalf of our students, faculty, and staff, we look forward to continuing and growing our partnership with like-minded organizations like Axiom to continue to provide opportunity, access, and equity across all intersections of healthcare.
The partnership with Axiom Healthcare Strategies and their foundation, Axiom REACH, is the most important partnership that we've developed in this market centered around Hope Lodge. Axiom has donated and pledged since 2020 a grand total of $150,000. To put this in terms of patients, this is the equivalent of adopting 15 of the 60 rooms at the Hope Lodge of New York for a period of 12 months. It's also the equivalent of funding 600 nights of lodging for cancer patients. In context and compared to other support and giving that we're receiving, Axiom is one of our most important and valued partners in this market. We're grateful and proud to call Axiom REACH our partner.
Axiom REACH and Dolan Fund, working together, are able to bring a level of logistical support and compassion to severe cancer cases that individually the two organizations wouldn't be able to match. We had a patient in Utah in college diagnosed with stage 4 cancer, but an opportunity to be part of a clinical trial in Dallas. The complications of lifting her life from Utah, putting it down in Dallas for 6 months, all the different issues of housing, parental support, contact with caregivers and transition of caregivers. Working together, Axiom REACH and the Dolan Fund made this a reality for this patient.